Following segment is sponsored by Munson Healthcare.
No one is ever prepared when a tragedy happens or knows what the best plan of action is, especially when a loved one is dying.
That's why planning ahead can help ease an already emotional situation. 7 4's Melissa Smith explains in this month's Your Health Matters.
End of life is inevitable, and it's something we don't like to think about, let alone plan about. I'm going to introduce you to a couple going through advanced care planning and why they say it's actually a gift.
We're not going to be here forever, and that I really believe this is a gift. When we complete this, it's a gift for ourselves and for our loved ones.
You might not think of advanced care planning or planning ahead for end of life as a gift, but after hearing from Chuck and Linda Mueller, you might think otherwise.
I've been dealing with my parents who've been in poor health, and my dad died 3 years ago, so I think that might be part of it.
For the past 7 to 8 years, the Muellers have been working together as a family on advanced care planning through Munson Medical Center. After losing his father, Chuck realized more than ever why it's important to plan ahead for those end-of-life decisions. This way, when the time comes, there aren't any uncertainties or questions for you or your loved ones.
This is my 5 wishes that got filled out in 2005.
Okay.
Yeah. So the mistake I made is that I filled it out and had Linda sign it, but I didn't talk about it with her.
The 5 wishes goes into detail what your loved one would want, should he or she be at a point where they can't speak for themselves based on their medical state. At first, Chuck simply filled it out, but now he and Linda are opening up the communication with one another and their kids.
I sense with my children, they don't want to even think about us at a point in time where we'll pass, because I'm proud of them that they have such a loving relationship with us. But things happen unexpectedly, and it's probably a good conversation, even though it's a difficult one.
It took me about 2 years to get my mother to talk about it.
The Muellers also attended advanced care planning workshops through Munson, including what the medical directives entail.
And so I've created the workshop to really help people identify who would be a good spokesperson for them if they are unable to make their own medical wishes. It's not just about end of life, it's about living now. We never know when something's going to happen.
Stephanie Van Slyke is not only an advocate for advanced care planning, but also works in Munson's intensive care unit. And she sees families dealing with traumatic, life-changing decisions on a daily basis.
We're rarely prepared for, specifically for crisis, but even somebody who's been sick for a while. A lot of times when you would hope families would be kind of pulled together, they're sometimes really pulled apart in those tough times.
Munson physicians are also hoping to be part of this push to plan ahead instead of having patients' loved ones making end-of-life decisions on the fly.
If you're not waiting for the patient or the patient's family to say, gee, should we have this conversation? It's kind of a physician-led, but that seems to fit again with what we're seeing for patient preference for other research.
This conversation has to happen before you're in that kind of a situation, you know, and you have to be really clear what you want, and you also have to be really clear that the person that you designate as your voice is willing to follow through with what you want.
The Muellers plan on meeting with Stephanie Van Slyke once again after they finalize their medical directives with their kids. In the studio, I'm Melissa Smith, 7 and 4 News.
The advanced care medical directives are free, and so are the workshops through Munson Healthcare. If you'd like more information, we have a link to Munson on our website, upnorthlive.com.